So, now is the time to stand with Planned Parenthood. Now is the time. We're under siege, as New York Times columnist Gail Collins just wrote. We're in the middle of the most serious attacks on Planned Parenthood's good name, on our ability to serve every patient today and tomorrow, and on our ability to participate in the federal safety net programs like Medicaid and Title X, and every other source of government funding. We're fighting for women and for women's health, and we're fighting to restore Planned Parenthood's funding, and we're fighting for Title X. Now's the time. This is a fight that we must fully engage in, and it's a fight that we must win. 1 week ago, on this very night, for nearly 4 hours, Planned Parenthood was the subject of debate on the floor of the U.S. House of Representatives. Not the economy, not unemployment, not jobs, not the quest for democracy that is rising in the Middle East and other countries, not any of these pressing, urgent matters. Planned Parenthood. Anti-choice Republicans vilified us because we provide abortion care. Some spewed lies fabricated by doctored videos filmed in secret in Planned Parenthood health centers. And even Representative Pence himself lied about how Planned Parenthood uses its federal funding. Do anything, say anything, red meat politics at the expense of women's lives and health. But our champions stood up for us. Many who have supported us for years. And that night there were even some surprises. The debate went on after 11 o'clock in the evening. And then Republicans finally cut it off because there were so many more Democrats, and by the way, one Republican standing in line, waiting to stand up for Planned Parenthood and to give their testimonial. Here are a few excerpts from that night.
I now understand what the purpose of this amendment is. It's to close down Planned Parenthood and all the good things that many of you admit that they're actually doing, just in order to accomplish this ideological goal related to abortion.
On an annual basis, Planned Parenthood health centers are able to offer nearly 1 million life-saving screenings for cervical cancer, 830,000 breast exams, contraception to nearly 2.5 million patients, nearly 4 million tests and treatments for sexually transmitted infections, including HIV.
Look, I'm a pro-life Democrat. I'm a pro-life Democrat, and my faith informs my position on this issue. I think we agreed at one point in this country that the best way to reduce abortion in this country is to prevent unwanted pregnancies. We used to agree on that. This bill, this amendment, will increase the number of abortions in this country. I don't have many friends in the Planned Parenthood community. They don't support me. I'm pro-life. But I respect the good work that they do.
I'm a cancer survivor. I'm a cancer survivor who was only here because my cancer was found in stage 1. And I can tell you that losing access to screening will cost lives and will kill women in this country.
Abortion dismembers children, piece to piece. The doctor goes in with forceps and this device and literally hacks that baby to death.
That procedure that you just talked about was a procedure that I endured. I lost a baby. But for you to stand on this floor and to suggest, as you have, that somehow this is a procedure that is either welcomed or done cavalierly or done without any thought is preposterous.
Let me tell you what it does to women who cannot plan their parenthood. It derails their ability to complete education and training so they can get a job.
Well, the American people, if they are listening, are scratching their heads and wondering, what does this have to do with me getting a job? What does this have to do with reducing the deficit? And the answer is nothing at all.
Planned Parenthood is healthy for women, it's healthy for children, and it's healthy for our society.
Profiles encourage, huh? The next day, on February 18th, by a vote of 240 to 185, Representative Pence's amendment was passed, banning Planned Parenthood from receiving any source of federal funding. And the very next day, the House voted to eliminate the entire budget for Title X, our nation's premier family planning program that serves over 6 million women each year. Make no mistake, this vote was not a surprise. Pence had introduced this in every Congress for the past several years. What changed this time? The 2010 elections. The seismic shift that has resulted in the U.S. House of Representatives now being 2/3 anti-choice. Finally, Pence had his votes, he had his day, and he could soothe the most fringe anti-choice groups in our country who demanded political payback. This is hardball politics at its worst, and it's a fierce reminder that elections matter. So now is the time to stand with Planned Parenthood because someone you know relies on us for their health care. 1 out of every woman in America has been our patient. For all of them, for this and the next generation, now is the time to stand with Planned Parenthood and to fight for Title X. Because Planned Parenthood and Title X have changed the lives for tens upon tens of millions of women in America. We have radically improved their lives, their health, and their futures for women and their families. We have given women the freedom to dream, to have more choices. Few organizations and programs have had more success. Few organizations have been as committed as Planned Parenthood to empowering women from all walks of life here in this country and abroad. Nearly 4 million women, men, and teens will receive their medical care from Planned Parenthood this year alone. 95% of the services we provide each year are preventive. They're not abortion, 95%. That's a fact. I didn't hear Representative Pence mention this fact last week. Now, he's entitled to his opinions, but he is not entitled to his own set of facts and his own version of the truth about Planned Parenthood and about our services. So now is the time to stand up to Representative Pence and to stand with Planned Parenthood. Over 6 million women this year will receive family planning services through Title X. The total budget for this program is $320 million. Okay? That means that we get, on average, $53 to take care of a woman for an entire year for her services. Pap smears, GYN exams, full birth control services, testing and treatment for STIs. $53. Not 1 penny is spent on abortion. And here's another compelling fact. For every dollar we invest in family planning services, we save taxpayers in Missouri over $6 in medical and other social service expenditures. Prevention works, and it saves taxpayer dollars. Title X and Planned Parenthood are the best investments we can make to ensure the health and well-being for millions of Americans each year. Every provider in the Title X program, including Planned Parenthood centers, we participate because of our commitment to serving women, especially those who are most at risk, underserved, low income, and uninsured. We have to win this fight for them. Here in our affiliate, nearly 30% of our patients have Medicaid. If we're banned from the Medicaid program, tens of thousands of individuals would lose access to services, and that means millions across the country. Our 850 health centers throughout America are vital to the success of the Medicaid program because each year there are fewer providers, physicians, physician group settings, other settings. There are fewer and fewer providers willing to take care of patients who have Medicaid. Why? Because Medicaid, for family planning, reimburses us about 62% of our costs. Every provider in the Medicaid program in Missouri and throughout the country participates willingly because of our commitment to serving those who are most at risk and most vulnerable. So we have to win this fight, and we can win this fight. I just long for the day, I have to tell you, when our staff at Planned Parenthood can come to work and just take care of the patients who need us. You know, that's a tall order in and of itself. And I long for the day when our staff no longer fears that every conversation, every phone call, every patient who walks through our doors is not secretly recording conversations and editing tapes and releasing them through a network of conservative media outlets. This is what it's been like for our staff for over 3 years, and I am really angry about it. Because these are some of the most committed, compassionate, and ethical people I know. And they work so hard every day to ensure that we can serve every person who walks through our doors, every person who needs us. And they do this great work now under this new form of unrelenting terrorism. Now is the time to stand with Planned Parenthood and to fight for women's health and for reproductive justice for all people. Since Friday's vote, now Cecile's video was taped day one after the vote, but since Friday, over 500,000 people in this country have taken action on our national website. And we expect this number to reach over 750,000 by the next week. On March the 1st, Planned Parenthood will have a huge lobby day in Washington, D.C. We will take our message, and we will take the messages from millions of our supporters and patients to the U.S. Senate. And on March the 2nd, we will conduct our largest ever nationwide phone bank to connect millions of Americans and our supporters to U.S. senators who must take a critical vote. And we'll be urging them to support Planned Parenthood and to restore funding for Title X. We can win this fight, and because of all of you, we will win this fight. We will win this fight, but I have to tell you, we have to get into the fight to win it.